My name is Dottie Lane, and I remember the first helicopter that came to the hospital. It was quite an experience to land the helicopter right by the parking lot, and there were no police there at that time, and they came, and it was just an awesome experience.
What was your job there,
I
Dottie?
was the PM supervisor.
During what era, do you know?
Probably in the 70s. I was there for 42 years.
Okay. What were some of the names of people that you worked with?
Mary Romater here, she's right here. And
How about any of the doctors? Do you remember the
Dr.
doctor's
Gibson.
name? Doc Gibson?
Yeah, he was here.
Uh-huh. How was that hospital? I mean, just the status of it. Did you work with a lot of nuns?
There were a couple of nuns. Yes, there were on the third floor. They were in charge of the hospital. Yeah. So it was very interesting.
Good. And Marge, what was your job at the hospital?
I worked the night shift, and I think I've been at one time or another on every floor there was, except I did work in OB too.
Oh, you worked in OB?
Yeah, but that wasn't my specialty. I wasn't that good at that.
Yeah.
But I was good otherwise.
And what era was that? What era?
I can't even remember.
No,
it's
huh?
more than 50 years ago.
What was that hospital like? What were some of the layout that you remember?
Oh, it's altogether different because we'd have like 4 patients in a room. And one thing I remember about that room, I was working in there, and the people that were in there were not as sick as people are now when they're in the hospital. And one patient said to me, "Nurse, why don't you retire?" I wasn't old enough to retire, but I said, I don't know, I never thought of it. It was the nicest time of my life when I went to work, because I had several children at home. And when I put my uniform on at night and put my white cap on, I looked at her and said,
So you had a uniform.
yeah.
Talk a little bit about that.
White uniforms and a white cap, depending on the school we went to. And I had graduated from Milwaukee County General Hospital in 1944.
So aside from working during the night, what were other things? Did you have any emergencies or?
Yeah, we had emergencies come in, and we had to open the front door for people. It wasn't like people come in like they do now. But I always tell the story about I was working on the first floor, and somebody rang the bell to come in, and it was a lady about to have a baby, I think, and it was about 12 o'clock at night. And I sent a nurse's aide to answer the door, and she came back up and she went to the OB floor, and she says, "I opened the door for this patient, she's a prime rib." Because prime if is a word they use for a woman having her first baby. I opened the door and she's a prime rib.
So did everything turn out okay?
Oh yeah, as far as I know.